How to know if your dog has a slipped disc. Dogs are susceptible to slipped discs in their backs, just like people. The intervertebral disc is a soft cushion that sits in the joints between the spinal vertebrae. A slipped or herniated disc can afflict any dog due to a spinal injury, but some dog breeds are particularly susceptible to back problems like intervertebral disc disease (IVDD.2). There is no way to prevent IVDD or slipped discs, but with the proper knowledge and planning, you can reduce your dog's risk of injury and nurse an injured dog back to health. Diagnosing a slipped disc. Recognize the symptoms. It can be difficult to diagnose a slipped disc or IVDD at home. That's because the precise location of the affected vertebrae and the degree of injury can affect how noticeable your dog's injury is. Neck pain, back pain, difficulty moving, a wobbly, uneven stride, inability to place paws flat on the ground, dragging one or more paws, complete paralysis. Assess any recent trauma. Some dog breeds are prone to developing skeletal problems. However, all dogs are capable of experiencing a slipped disc if they are seriously hurt. If your dog has fallen from any height, been hit by a person or object, or been involved in a traffic accident including being in the car during one, your dog may have sustained spinal injuries. If you suspect your dog has sustained a spinal injury due to physical trauma, contact your veterinarian immediately. Identify breeds prone to skeletal problems. While skeletal problems can afflict any dog breed, these issues tend to strike dogs with disproportionately short limbs. However, some larger dog breeds are also afflicted. Dachshunds, Pekingese, Shih Tzus, Beagles, some Poodles, Cocker Spaniels, Welsh Corgis, Basset Hounds, Labrador Retrievers, German Shepherds, Shar Peis. Make an appointment with your vet. Whether your dog is of a breed prone to IVDD or has sustained a spinal injury, your vet will need to see your dog right away. A vet can help rule out other problems, diagnose the problem with your dog, and recommend a treatment plan. Your vet will need to perform a full neurological exam, as X-rays alone are usually insufficient at identifying a slipped disc. Some tests your vet may run include an X-ray with dye contrast, a computed tomography (CT) scan, magnetic resonance imaging (MRI), or some combination of these tests. Your vet may also draw a small sample of cerebral spinal fluid to rule out a spinal infection. 8. Learn your dog's prognosis. When your vet determines that your dog has a slipped disc, they will also be able to assess how severe the injury is. If the slipped disc was caused by trauma, your vet will instruct you on how to heal it. If it was caused by degenerative disc disease, your dog may require a more comprehensive treatment plan. Stage 1 – mild pain which usually heals on its own within a few days. Stage 2 – moderate to severe pain. Stage 3 – partial paralysis resulting in staggered or uncoordinated walking patterns. Stage 4 – paralysis with feeling intact. Stage 5 – paralysis and total loss of feeling.